We are in the midst of one of the worst public health crises that the United States has ever seen.
More than 2 people a week are dying from drug overdoses in Multnomah County. That's just the tip of the iceberg, though, as there's more than a dozen ambulance responses every single week for overdoses, most of which leads to recovery.
The statistics shared by Dr. Paul Lewis saddens me deeply. What I have learned firsthand is that behind every statistic is a story. It's a story of a parent who can only imagine what their child's life would be when they grew up. It's a story of a family whose lives has changed forever because they lost a parent due to overdose. It's a sibling whose lives were turned upside down with the loss of a brother or a sister.
20 years of liberal opioid prescribing has shown us that our current path for chronic pain treatment is not working. The prescription opioid epidemic has now affected many of us, both personally and professionally. Each day, as a primary care provider and an addiction medicine provider, I hear stories from patients and families about the negative effects that opioids have had on their lives and the lives of their loved ones.
Improving opiate prescribing has to be coupled with a change fundamentally in the way that we approach pain. The way that we've understood pain in the past has in fact led to some of the significant difficulties that we've had with treatment. Understanding pain is critical for both the patient and for the whole care team.
Better, safer, and more effective chronic pain treatment is available. We know that to truly be effective, we need to help providers change their behavior and practice as well. We cannot emphasize enough the importance of expanding addiction treatment as well. We cannot decrease the access to opioids without having effective treatments available to patients.
The first thing to remember is really that this is driven by providers. These standards were not created by insurance companies. They were not created by CCOs. These were created by health systems and their providers coming together, as Nora said, and creating a standard because the providers saw what was happening to their patients. They saw the harm that was happening as a result of overprescribing. We've known this, but everybody has felt that it's really hard to get out of this box.
We are all here today talking about overdose and how it affects our communities, and we're all here because we are a part of the solution. Addiction is a multifaceted issue that needs many, many, many different interventions in order to move forward and take us out of this epidemic. I've worked with this community for over 9 years, and this work that we are doing here today is going to save lives.